Okay, now it's recording and
Yes.
now I can share again and then we can start. Come on, open, there we go. Uh, and technology is uh, most annoying, but there we go. We're on.
Yes.
Okay, so hello everybody, good to see you. Today, I'm Dr. Truth Sayer. I'm going to be talking about Transcendental Essences Therapy. And for some reason, my PowerPoint, the size of the text has all been affected. So put up with it. Oh, now it's not even working. Let's see if I can, maybe I can't do slideshow. It is not, for some reason, just not working. So maybe I have to just do that. I'm
Yes.
sorry, it's not as pretty, but we'll still go ahead. So what I'm going to do today is I'm going to present a case first. Then I'm going to give my bio in more detail than normal because I'm going to tell you my background, all of which went into creating Transcendental Essences Therapy, a little bit about homeopathy, which Transcendental Essences Therapy is based on homeopathy. Then I'll talk about what it is, how it works, the role of the practitioner, and hopefully we'll have time for questions. So starting with a case. So a case of TMJ. So a 15-year-old boy with a history of 4 years of severe TMJ. So the jaws are locked, unable to open the mouth very much. The most is you can open about the width of one finger, and the jaws are aching. There's sharp pain here and there, and there's tenseness, especially when eating or sleeping, but periodically all the time. And this has been going on for about 4 years. Um, and so the case came to me for acupuncture. And currently what I'm doing is long distance medical Qigong acupuncture. So I am working on the points as I would with needles in the office, but due to the COVID world, I'm using medical Qigong long distance, but it is doing the same. I get the same results as I get in the office with needles. Okay, so the patient's coming to me for a physical issue. In the intake, I ask about the emotional side and find out that they have about 5 or so years of depression that used to be severe, and they're in therapy. The depression is reduced, but still a 3 out of 10. Anxiety is approximately 3 out of 10, historically much higher, and anxiety was lifelong. Panic attacks used to be daily, and now they're about twice a month. And the panic attacks have been about 5 years. And there's a history of bullying both at home and at school. So, so I gave a total of 6 long distance medical Qigong acupuncture treatments. And the progression was after the very first treatment, the pain was, well, actually the pain was gone in session, but during the week there was still some pain, but the pain was reduced. And slowly in 6 sessions, the range of motion was increased so that after the final treatment, the patient could insert 4 fingers and open them up that wide without any pain, without the sense of being locked, without any tension. So at this point, after the 6 treatments, then you want to see if the patient can hold that improvement. And if they can hold it, they're done. But then I want to talk about the Transcendental Essences Therapy. I mailed the Transcendental Essences remedy to the patient. They got it the second week. And after the first week of using the remedy on a daily basis, I asked the patient what their experience was, and the patient's response was, "I don't notice any change," which is relatively typical. So I asked the parents, and the parents said that the patient was, the whole energy was much lighter. They handled stress better. The communication with the parents was better, and there was a sense of ease. After 4 weeks of using the Transcendental Essence Therapy daily, the patient reported an improved emotional state overall, a feeling of self-confidence, a change in perspective, less anger. And I said, "Has anyone around you noticed the change?" And he said that the best friend said that she noticed that the best friend since kindergarten noticed that his whole being with him was different. And I sensed much more presence in this patient. So that was after 4 weeks of using the remedy daily. I'm going to go into a little more detail as I talk about things. So my background as a spiritual teacher, which is, I don't teach any tradition. I teach people how to create and work a personal spiritual path, regardless of religion. So how to actually find your purpose and manifest into reality. As a spiritual healer, how to heal on spiritual levels, transform consciousness, and work an energetic, emotional, mental alchemy, which I'm going to go into more detail with this case. What the patient experienced in that transition was an energetic, emotional, mental alchemy. I've taught retreats for more than 9 years, workshops, work with mindfulness, meditation, visualization, shamanism, past life healing, crystals, feng shui, qigong, which is what I use now for long distance acupuncture, energy healing, transcendental essences. I compose, perform harp and piano music specifically for healing, and I've taught workshops on how the energetics of sound for healing. All of this is energy medicine. It's all energy, including acupuncture, is all energetics. I was a psychotherapist, 3 master's degrees in counseling psychology. I'm licensed as a licensed marriage family therapist with over 30 years in private practice. And let's move on to Doctor of Chinese Medicine. So I have a master's and a doctorate in Chinese medicine. I'm former faculty at ACTCM, one of the best acupuncture schools in America, president of the largest association for acupuncture in America, 20 years clinical experience in Chinese medicine, and a disciple of Dr. Huang Lichun, who is auricular medicine specialist. And I founded the Institute of Auricular Transcendental Medicine, taught there for the past 7 years. So then with that background, I created Transcendental Acupuncture, which is using acupuncture. It's based on classical Chinese medicine. It uses acupuncture to go to where spirit infuses matter in the body. And all acupuncture moves qi. So transcendental acupuncture moves qi on the deepest levels and produces or stimulates transformation of consciousness from the inside out. Transcendental Essence Therapy works from the etheric level with homeopathy and creates a transformation of consciousness from the etheric level working in. I created Transcendental Medicine, which, let me go down another slide. It's a system of medicine. The conceptual framework is based on the Bible of Chinese medicine, which is the Huangdi Neijing. And the basic assumptions is our being is comprised of various physical biosystems. So if you have a mobile hanging from the ceiling, you know, those things that have little things, they're all connected to each other. And if you move one of them, they all move. So using that analogy, our being, the physical biosystems are all different buckets, like reproductive system, your limbic system, your neurological system. All of the systems are in a bucket. And then you include mental, emotional, and spiritual systems in buckets as well. They're all connected. When you have a disharmony, on any level, it pulls out of harmony. That affects all the other systems. When you're treating a disharmony, as you are helping it to come back into harmony, it's also affecting all the systems. So my understanding of treating any kind of disease on any level is that you need to understand the whole, and you need to be mindful of all of the interactions as you're working with the whole. So each part of it, you're thinking of within a framework of the whole. That's what I call transcendental medicine. And the other aspect is that the healing needs to go to the root cause and cause a shift in consciousness. That's a requirement. So if you think about the case that I just talked about, the patient came in for TMJ, jaw pain. No doubt I could use acupuncture to relieve that pain very quickly, which I did. But if you want lasting improvement, you have to go to the root. The patient had bullying experience at home. The patient's brother was autistic, and there was constant fighting, emotionally and physical. The patient had bullying at school. These created emotional difficulties, mental difficulties, which were affecting the physical body and the tension being held. If you don't deal with the overall picture, I can relieve the pain, I can relieve the inflammation very quickly and easily, even at a long distance. However, if you don't deal with the other levels, it will come back or it will mute into a different disharmony. So for thorough healing, you have to go to the root. So Transcendental Essence Therapy uses homeopathically prepared flower, herbal, mineral, and other essences. So most homeopathic remedies have both a physiological and mental emotional indications. For Transcendental Essence Therapy, I only use the mental emotional indications. Homeopathy is a system of medicine established 1796 by Samuel Hahnemann, uses the principle of like cures like. When I was last in Taiwan, we were taking a day off from presentations, and we were driving up very, very windy road, and we're getting very nauseous, many of us, from the windy road. And so the driver stopped and from a little shop got some kind of plant. I don't know what it was, but it tasted extremely bitter and it was nauseating. But when you ate this bitter, nauseating thing, it cured the nauseousness that we were feeling in the bus. So that is the principle of like cures like. Homeopathy does that by taking the substance and through a process of dilution, ultimately what the remedy has none of the original substance and only the energetic essence to it. So homeopathy is an energetic medicine. So the next, I'm going to save time. So I'm going to talk about tea, thyroid gland of the sheep, arnica. I was just giving examples of different kinds of remedies that have both physiological and emotional indications. I might use any of those, but only be using it for the emotional indications. Then the flower essences all have emotional indications, spiritual indications, but they might also have physiological indications. And as you can see, but I'm not using them for the physiological. So I'm just going to rush a little bit. So with Transcendental Essences, I mostly use block flower essences, but I also use any other homeopathic remedy that has the emotional function that is appropriate to that particular patient. And so I say that flower essences are to homeopathy what psychotherapy is to psychiatry, because in homeopathy, the materia medica is vast and complex and deals with all the physiological and psychological issues, but the flower essences are dealing with sort of the belief systems, the emotional aspect, and helping to transition on that level. So why not call it flower essence healing? What am I doing differently that I call it Transcendental Essences Therapy? So what I'm doing is making it into a therapeutic process that uses the homeopathy, the practitioner's skills and energetics to induce transformation for the patient on mental, emotional, behavior, and spiritual levels. Give you another example. A patient, a young patient that is finishing college, she's in an internship, and she's been in that internship for a year and a half. That internship was supposed to start paying her after about 3 months. She's still not being paid. She has a boyfriend. The boyfriend borrows money, gets her to give him rides all wherever he wants, is very controlling. Worked with this person for maybe about 6 months of psychotherapy and taught self-assertiveness, taught an understanding of her history and how these patterns developed, a lot of skills that I taught her, and still there was no shifting with her behavior. Gave her a Transcendental Essence Therapy remedy. Within a few weeks, maybe 2 or 3 weeks, she comes back and I asked her, what has she noticed? She said, doctor, I must apologize. I'm so sorry to disappoint you. I'm using the remedy every day. Hasn't been any change. I said, no problem. Don't worry about it. What's going on? How are things going? Well, I finally talked to my supervisor at the internship and let them know that the original agreement was 3 months. And if they aren't going to adhere to it, I'm going to be looking for work. They decided to keep me and to give me a salary, and I'm hired. Fantastic. What else is going on? Well, I had a fight with my boyfriend. How is that? Well, he asked me to borrow money, and I said that's just not convenient at this point. And then he asked for a ride to go wherever, and I said, fine, that's not a problem, I'll take you. But when we got there, he wanted to go somewhere else, and I said, you know what, I can't, I have a plan, etc. So this person's entire behavior had shifted within that 2 to 3 week period, and they had no awareness of it. So the skills that she had learned in psychotherapy were now being used. So that is part of the process. And it's called transcendental because the patient has to experience a transformation of consciousness. If I left it at that, the person may have gone back to old patterns. But because I then work with the patient to help them understand the shifts that had happened, and they could own it for themselves, this patient will not go back. This patient will go on to a great life. Okay, so the process, the symptom reduction without transformation of consciousness is incomplete. The symptoms may return or morph. So the goal is transformation. If we look at the original case, initially the patient had no sense that they were changing. Their parents already saw it. They were already changing. And then over the 4 weeks, I asked them, and my asking them helps them to understand and see their process. There was also, I believe, an issue of benefiting from the lockjaw. This patient's brother had autism, and the family was very focused on the brother. So this particular patient wasn't getting the kind of attention that he needed. Having a physical issue also gave attention. If you don't deal with the emotional side of this issue, it will continue. So even though the essences moved the patient out of this need on an energetic level, helping the patient to understand their process makes it permanent. Okay, how does it work? How does energetic medicine work? How can I could case after case of instant results. How does that happen? So, if you have 2 tuning forks, if you, the doctor will take the one tuning fork and hit on it, it will vibrate, make sound, and use it to check the conduction of sound in your body, right? If you take a second tuning fork and you don't, you just hold it. So it's not vibrating or making sound. You click the first tuning fork, the second one will start attuning to the first. The vibrations will hit it and it will start making sound. That to me is how the homeopathic essences work. If you do a correct diagnosis, the remedies will vibrate in the etheric field, and the person is like the second tuning fork, and they will be attracted. If they need the remedy, they will be attracted, and they will begin to attenuate or tune into the essences, and their vibration will begin to shift. And as it shifts, it will go into their energetic bodies. So we have the etheric spiritual level body, we have the mental level body, we have the emotional level body, then the physical body. So as the patient is resonating with the remedy, it works inwards into the mental body. So the patient said, my perspective shifted. That's happening in the spiritual and the mental body. And then at some point, the depression completely lifts. That's hitting the emotional body. And then at some point, it may even work into the physical body and help reduce the tensions in the jaw. So it produces harmonic shifts that then produces shifts in thinking, emotions, behavior, and consciousness. But as you can see in that case, those shifts are happening before the consciousness. And some people don't quite get to consciousness, so I have to help them. The diagnosis needs to be accurate. If it's inaccurate, it won't have any negative side effects, but it won't have any effect at all. So if it's a partial accuracy, you get a partial or incomplete effect. The remedy works equally well, whether it's taken internally, whether it's put on the skin, or whether it's sprayed in the air. And I advise people to use all 3. How much to use? If you take, with homeopathy, if you take 1 drop of the mother remedy or the entire bottle, it will have the same effect. So that using more than a drop would be a waste. If you want a stronger effect, more often. So if you have somebody that just had a car accident and they're in a state of shock, then you want to give them the remedy every few seconds. So either you take, the patient gets the mother remedy, which will last, in my experience, every time it has outlasted the problem, every single time. So it'll last months. So mother remedy, you take a third of the dropper or half a dropper, put in a water bottle, shake that hard about 20 times. It's now medicine. You can sip on that. Or you do the same in a spray bottle. You spray the entire house, closets, under the bed, everywhere. What's the effect on a bystander? Well, you have a wife who has depression, and the depression is affecting her husband, her kids, and the animals in the house. So to the extent that her depression is affecting her family, when she sprays it in the house, they experience a kind of lifting of their mother's energy that's weighing on them. But it doesn't affect them in terms of their issues unless they have an exact same issue. Otherwise, it'll have no effect on bystanders. What about placebo effect? I get incredible results with my formulas. So if science told me this was entirely placebo, I'd say, great, wonderful, let's go with it. However, placebo effect can't explain to me the effects on children and animals. So one year I had a slew of 18-month-old babies. So the first baby comes, the parents are both working full-time, and the boy is biting the other children in daycare, about to get thrown out. And if the child is thrown out of daycare, the parents are not going to be able to work, and they have high stress jobs. So I made up a remedy, and I actually put it in the water, mixed it for them. So it was in a spray bottle. And this was actually in the waiting room, and my assistant was there. This baby grabbed the bottle and sprayed himself until he was soaking wet. This is an 18-month-old baby. It was really just an amazing event. And afterwards, the biting stopped completely, never to return. I had another 18-month-old about the same time, and she was scratching. She was not in daycare, but any event she went that there were other children, she would scratch, and the parents wanted to do something about it. So gave her a remedy, she took it home, and they came back in 2 weeks to say that the behavior had completely disappeared. And animals. So I had a couple that had adopted a dog, and the dog had extreme separation anxiety. So was tearing down the door, tearing down the furniture, and they couldn't get this dog to calm down. Anytime they left the house, it was a mess. Gave the dog a remedy, and they didn't have to worry about the furniture anymore. Did that completely solve it? Not exactly. So they would spray the remedy for a few months every time they left, and then they didn't need to spray it so often, but every so often it would still come back, and they would use the remedy, it would still work. So that was approximately that. I have so many cases that I could say. The other thing I would say about placebo effect or belief in it. I had a case where there was a couple, and the wife they weren't married, but they were a couple, they lived together. So she was my patient, and her boyfriend had severe PTSD from childhood trauma. And so periodically, maybe it's in the beginning, it was more like 4 or 5 times a year, would have mental breakdowns that were really severe. And he would go maybe drink, he would go to really bad neighborhoods. She was afraid he was going to get into fights. or get arrested. Uh, he broke down. He almost didn't know who he was or where he was. It was very severe. And he wouldn't go to therapy. And she tried to, you know, talk him into it, couldn't do it. So she asked him if he would be willing to take a remedy. And he said, I don't believe in it. And she said, it doesn't matter. But would you be willing for me to give you the remedy? And you don't even, it doesn't taste like anything. You can't even see it. Would you mind if I did that? He said, okay, it's fine. I don't care. I don't believe in it. Do whatever you want. So I made a remedy, gave it to her, and he went from like 4 or 5 times a year down to like twice a year. It was much less severe. He became willing to go to therapy, and he started therapy. It wasn't a smooth process. He stopped therapy, had a few more breakdowns. Then he went back, went to therapy, but the shift was pretty dramatic. And this is somebody that didn't believe in it, didn't even know when it was being used, and it had that kind of dramatic effect. So it goes very deep and produces shifts for people. So the practitioner, you know, they say that a teacher can only take the student as far as their own development. This is true, but how does this work? It has to do with the energetics. So I believe that part of the reason that these work is because the practitioner also resonates in the etheric field, and their level of consciousness helps the patient by attraction, you know, not by what's said. I mean, that helps the patient to take in the reality, but actually to shift, it has to do with the practitioner's own vibrational level, and that works along with the essences to help to induce a shift. And then the practitioner needs to help the patient to recognize and acknowledge the shift, so that the patient can own their experience. All of that is part of the therapeutic process. This is a quote from a 6th century Chinese philosopher. This is at the heart of Chinese medicine. And it says, if the spirit is at peace, the heart is in harmony. When the heart is in harmony, the body is whole. If the spirit becomes aggravated, the heart wavers. When the heart wavers, and the heart in Chinese medicine is both emotions and thinking process. When the heart wavers, the body becomes injured. If one seeks to heal the physical body, therefore, one needs to regulate the spirit first. So, 2 other quotes, but I'm saving time. So the practitioner needs to cultivate qi and understand how to work with qi, which in English is energy. It's really not the best word, but there is no other. So it's vibration, it's energy. The practitioner needs to have the ability to sense, feel, recognize, and how to work with qi, because the matching of the vibration of the essences to the patient's vibration is what creates the dramatic progress. When it's off, you get partial, incomplete results. This enables practitioners to align with the patient's, ergo correctly diagnose and prescribe. It also enables the practitioner to lead the patient into new experience, new consciousness. And also to say about sort of placebo and belief, I used to tell the patients what was in the remedy when I gave it to them. And I would, because I thought it would help them to understand everything. And then just to test placebo effect, I started not telling them anything. It's just plain, you know, there are no chemicals in it. There's nothing. It's water. It's energetic. Use it. Same. I got the same results. So the patients don't have to know anything about the remedy. It still works. Okay. I think I got, wow, I really went fast. I was so afraid of going over. I really went fast. Okay, so I talked about the in the children, there's also a dramatic case of a child a little older than 18 months, but um, her mom was about to give birth, and uh, the child had enormous separation anxiety and didn't want to be away from the mother, wouldn't let the father put her to bed. The father was really feeling like he was missing out on bonding with her, and he wanted to put her to bed and be with her and to take that off of the mom, because mom was about to have a new baby to take care of. And it wasn't happening. She wasn't allowing it. She was having fits, and gave her a remedy. And 3 weeks later, they came back. She is allowing dad to put her to bed. She is not fighting with the mom. She is, she's being, she's just totally happy. And she was, I think, 10 years old. Yeah. Oh no, that 10 years old was someone else. She was a little over 18 months. Then a 10-year-old, he was a, he was from the first father, and then the mother remarried and had 3 kids with the second father. So um, so he had issues with his birth father, and his birth father was somewhat abusive, neglecting, and he had a lot of emotional issues. Um, and so what would happen is his oldest brother, the younger than he, but the oldest of the young siblings, idolized him and wanted to be with him all the time. And due to his emotional issues with his dad, he found it annoying. He was rude. He pushed him away. Okay, gave him a remedy. And the parents called me back the next day with this report that that night he was performing. His younger brother wanted him to teach him guitar and to play with him. And he turned around to his younger brother and talked like an adult and said to his younger brother, I'm going to be performing later. I need to practice. You can sit quietly and listen to me practice. And I promise I will start teaching you after my performance. And so he went, that was the very day he had the remedy. He went on to have much less depression about his dad, and a better self-esteem, and created a wonderful relationship with this sibling that really idolized him. So if I have time, maybe a couple more cases, and then we'll talk questions. Lots of animals, including, so animals don't like spray. And not only, if you put remedy in the spray, not only do they like the spray, but actually I had one of the animals went to the mom's remedy and drank the mom's remedy. So animals are not at all defended. Animals and children don't need me to help them recognize how they're shifting. They're not defended. They just shift, and it's amazing. Adults, I have to work with them to get them to not to, eventually they see the shifts, but okay, here's a good example. So I had a patient who was living 7 years with one boyfriend, and her ex-boyfriend they were still, quote, friends, but they were still in relationship. And the ex-boyfriend wanted to marry her, wanted to take care of her, loved her to the moon, but she didn't want to be with him. And the boyfriend that she chose to live with was selfish, treated her poorly, ignored her, and she was constantly wanting to get his attention and wanted more from him. And she couldn't decide which one, and she was driving herself crazy. She came for psychotherapy. We worked on it for I don't know, again, maybe 6 or 7 months, I don't know exactly. And, gave her all kinds of insight, gave her information, helped her to understand what this was about, family of origin issues. Nothing changed. She's still struggling between the two and what to do. Created a remedy, gave her the remedy. She came back the following week and said that she had gone out and searched for an apartment, found an apartment, got the lease, was in the middle of signing the lease to the new apartment. In other words, she was moving away from both of them and moving on to her own life. And her boyfriend came home and talked her out of it. So she didn't move. And I think this is an example where if you do not work with a patient's consciousness, they can go right back to the old pattern. And so this is an example of that. So I think that's good in terms of cases. I think I'm going to open up for questions, and maybe I'll share more cases with the questions. Thank you all. I'm really delighted to have a chance to talk about this therapy. Thank you. So, to contact me, you can go to my website, drtruthsayer.com. It's an old website. I apologize. Not only is it old, but GoDaddy took it down and put it back up, and everything was rearranged, and it really is a mess. So I am going to redo it. But actually, I never did it, so I have to find somebody to do it. But it's still, you can contact me through that, and it has information. So questions?
First of all, awesome.
Thank you.
Awesome.
Thank you.
So it's like I found my pair.
Thank you.
So the consciousness and the spirit that you were talking, so we all homeopath, but the thing is based on the host. Okay, I thought I lost you.
Did I lose? I just want to stop sharing the screen.
No, I thought I lost you, but you're still there.
Okay, so
Dr. Strusse, you have stopped the screen sharing. Yes.
Oh, okay, but now I have to, can you stop it again? Hang on one second. Can you stop it again now?
Yeah, sure. Oh, okay.
Great.
Yes.
Okay, thank you. Sorry for that. Yes.
Yeah, I mean, based on the philosophy of homeopathy that we all know, we always talk about quantum life force or a spirit-like energy, or it all refers to the non-physical body.
Yes.
That's what we refer. But
Yes.
when you talk about consciousness is the higher self. It means it's way beyond the physical and even non-physical level.
Yes.
So the way that you explaining that the remedy can go transcend to the consciousness,
Yes,
from all the physical, because we know that emotion, we have emotional body, mental body, and earth body. These are all physical.
yes.
Then we have another one, which is non-physical, is completely energy. And we have a consciousness, it's a higher self.
Yes.
So when the remedy, it goes through all this level of different bodies and passes the energy body and goes to the consciousness, it's fascinating. It's just so much fascinating. So I never explained it this way, the way that you did. But it makes sense. It just makes sense because that's how it's changing the frequency of the person. Yeah, but your explanation was kind of new to me, but it just makes so much sense.
Yeah.
That the remedy can pass from all these bodies and goes to the consciousness. and and brings back the balance and harmony to everything. So thank you so much. I appreciate it. And
You're
it was
welcome.
awesome.
It isn't, I mean, it's just, thank you so much, but it's the vibrating on the etheric level that if the patient needs that remedy, they're automatically going to want to drink of it. Their body starts shifting in their own vibration. And that's what causes all the shift, is as we all vibrate. And as the vibration is shifting, they're experiencing the effects of that. And the shifting is because they're attracted to the practitioners of higher vibration or different vibration, or they're attracted to the remedy vibration, and they start to resonate with it, just like those tuning forks.
Right.
The vibration is there, but the other tuning fork resonates. That's how it produces sound. And so the person is the second tuning fork. They begin to resonate. So that it's like the word in English, attunement. You know,
Yes.
you are attuning to that. So they are doing it if they need it. If it's not what they need, it won't even affect them. But the person who said they didn't believe it, they didn't want it, they were attuning because on some higher level, they were needing it. So they were attuning. They don't have to believe it. They don't have to want it. They have to want it on a higher level. They have to feel on an energetic level, they know that they need that. It's like, why are we attracted to somebody? Where is that attraction taking place? If I'm looking for a practitioner, I just have this sense that I want to work with that person. What is that sense? It's something on a higher level. And I depend on that for people to work with me. I want the people that are attracted on that level because I'm going to have success with them, right? Because it doesn't have to be conscious. It just has to be vibrationally. I have something they need. Yeah, they can tune in.
Absolutely.
Right. Thank you.
It goes to all level of any form of relationship as well.
Yeah.
At the work relation, the romantic relationship, work relationship, parents and children relationship. This all goes back to tuning and alignment, and that all goes back to the frequency of two individuals that it has to match. Has to match in order to bring them into balance. So this is absolutely so. Yeah. The way you explained it, it's just was great. Thank you so much.
Yeah, thank you so much. Any other question?
Yeah, I did have one. I really enjoyed your talk. My background as a naturopathic doctor, I also have used homeopathy. That was one of my specialties for 30 years. I love the way you describe this consciousness piece because one of which I'll be presenting on Bowen therapy, and some of you were already here last time, but it's that attunement that you feel. And I wanted to add this thought is that we are so much viruses, microbiology, like so much of us is actually, our microbiome is all these other cells, viruses, bacteria. So when I'm thinking of attunement to consciousness, it's as if our entire body also resonates with all of these microorganisms that we have processed.
That's absolutely correct. Absolutely correct.
I really enjoyed the perspective and the wording of it. That was excellent.
Thank you. Thank you.
Yeah.
Yes. Thank you. Thank you very much, Dr. Truce. Excellent.
May I have one question, Mr. Nawaz?
Yes, sure,
okay,
please.
No problem.
Please
There is
ask
time.
quickly.
Okay.
Yes.
Thank